Joining us now is Dr. Keith Lindor, who is Executive Vice Provost and Dean at Arizona State University. Thank you so much for joining us.
You're welcome.
I'm going to get you to talk to us about the presidential plenary on translational, I want to get this right, translational advances in hepatology. What's that about?
Well, this is really a chance for the listeners to hear about some of the changes that are starting to emerge from scientific work that's being done in the field. And I think that they will see that there are really some potentially important take-home messages that will come from this. So we're seeing advances that are starting to open the doors to new lines of research, as well as some changes that are going to be practical immediately.
And talk about some of the focuses of this.
Sure, there are two of the abstracts relate to drug-induced liver injury, an important problem in this country. Two are really one's a clinical trial and another is an observational study that help refute some traditional thinking about management for patients with chronic liver disease. And then two others are really, one is starting to open up some insights into what leads to the development of cancers from hepatocellular adenomas, and the other is giving us some new insights into a potential marker for the treatment of non-alcoholic fatty liver disease in children that may help us avoid needing to do liver biopsies.
That sounds fascinating.
Yeah.
So what are the takeaway lessons, I guess, if you want people to take away from this plenary?
I think there are several. One, that in patients with drug-induced liver injury, a low platelet count can portend problems. People who do poorly tend to have their platelet counts drop. Another is that bodybuilding drugs in those supplements can cause a cholestatic liver disease, and that has really, in this period of time that they observed, almost tripled. So that has become an important cause of drug-induced liver injury. Another is that in kids who have biliary atresia, after they have biliary diversion surgery, using corticosteroids does not seem to help. So that's important. They shouldn't be used. Another is a study that showed from Denmark, a large population-based study, that beta blockers in the setting of patients with refractory ascites are not leading to death, in fact are keeping people alive. So a previous study had suggested that beta blockers used in that setting increased mortality. So this large study directly turns that around. I think we're also seeing in another study that the use of cytokeratin 18 can be helpful in predicting the response on liver biopsy in pediatric patients with non-alcoholic fatty liver disease being treated. So that's important in that it may allow us to monitor therapy without needing to do liver biopsies. And then the sixth abstract relates to some insights into factors that will, we hope, eventually allow us to predict which patients with hepatocellular adenomas will develop carcinomas.
Sounds like a lot of good lessons for our clinicians
Yeah,
to take away.
I think that's why we're excited about this session.
That sounds great. Thank you so much for joining us.
Well, you're welcome.